Hi, welcome to Blake 6. A little background on Blake 6. We're the only dedicated transplant surgery floor in the hospital. We have a wonderful group of nurses, doctors, nurse practitioners, physician's assistants, social workers, pharmacists, case managers, nutritionists, and physical therapists that are dedicated to care for transplant patients. We are excited to work with you and your family. You are here today for pre-op education, which is to help you become familiar with the plan during your admission here with us. We as a team want you to feel comfortable and involved with your care, which is why this is an important aspect of receiving your transplant. We encourage you to share this information with family that will be assisting you before, during, and after your transplant. This next section will only pertain to you if you do not have a living donor. First, let's start to discuss how you will be informed about an available organ. You will be called by the Buckeye Transplant Coordination Team regarding organ availability and will be told to come to MGH and report to Blake 6 or another unit depending on bed availability. You will be told at that time to stop eating and drinking. Please make note of the last time you had a full meal or anything to drink. This is crucial to follow as you need to have as much of an empty stomach before surgery as possible. On arrival to the floor, you will be seen by a transplant surgeon and nurses. Multiple labs will be drawn, admission paperwork, consents, and other pre-op testing will be completed. This will include a chest x-ray and an EKG. Depending on your lab results, transplant nephrologists may determine that you need pre-op dialysis. There is a possibility that the surgeon may tell you that the kidney is not the right match for you. This has happened before and is not unusual. In this case, you would be able to return home if you had a ride home or if you were able to drive yourself. These next topics pertain to all transplant patients. If you are a diabetic, monitoring of blood sugars will be done throughout the hospital admission. Blood sugars may vary depending on medication changes, etc. It will be important to inform the surgeon and nursing staff when you were last dialyzed, if on HD or PD. Please show and alert your nurse and surgeon about what access device you have for dialysis, whether it is a fistula, graft, or line. Surgeons will inform you on the time of surgery and any other information regarding your operation. We encourage family members to wait in the gray family waiting areas for updates while the patient is in surgery. Pre-op immunosuppressant medication will be given to you prior to going to the OR. You will be given a mask to wear when leaving the floor. This is to protect you as the immunosuppressant medications make you more vulnerable to infection. Once taken to the OR, anesthesia will be placing at least 2 IVs for access. They will not be placed into the fistula or graft arm. Peripheral IVs will stay in place until day of discharge for fluid repletion and medications. A urinary catheter is placed in the operating room. To note, the urinary catheter is to stay in place for a minimum of 3 days and cannot be removed earlier. This is to ensure accurate measurements of urine output. This also allows the renal doctors and transplant surgeons to determine the need for fluids, adjustments to medications, and/or doses of medications. There is a possibility of a small drain called a JP drain to be placed near a surgical incision, but that is determined by the surgeon if deemed necessary to drain fluid from the surgical site. Surgery lasts on average about 4 hours, and then you will be sent to post-anesthesia recovery unit to recover for a minimum of 1 hour, then return to Blake 6 for the rest of your recovery. There is always a possibility that you would require further monitoring and would be transferred to the ICU post-operatively for a temporary stay. On return to Blake 6, nurses will monitor vitals, urine output, and fluid balance hourly for the first 12 to 24 hours. Lab work is drawn frequently after surgery, 1 hour, then 4 hours after surgery, and then at minimum daily in the morning at 4 a.m. for morning rounds, so the doctors can determine the plan of care and medication dosage adjustments if needed. You will have an ultrasound done after surgery as well to check the kidney. Patients will have IV fluid to maintain hydration and replace any fluid from urine output. IV pain medication will also be infusing on an as-needed basis, but only for the first night after transplant, and then we will transition to oral pain medication as needed. For the IV pain medication, you will be given a pain medication pump that allows you to safely administer the medication for pain relief through your IV. Once on oral pain medication, you will have to call your nurse for when you need them, as they are ordered as an as-needed basis. Doctors will determine which pain medication will best suit you, and you are encouraged to wean off opiate pain meds and use Tylenol as a primary pain relief medication. Immunosuppressant medications will also be infused into your IV once a day for up to 3 days, depending on your plan of care. This will be explained more in the next section. After surgery, you will still not be allowed to eat or drink to avoid aspiration and other complications. You will be allowed to have some ice chips for comfort and sips of water for your medications that first night post-op. Patients who are diabetic may have IV fluid that contains dextrose, which is a sugar source, to help maintain adequate blood glucose levels. If needed, a consultation with a diabetic specialist will be made for better blood sugar management. You will start immunosuppressant medications the night of surgery. The RN assigned to you will inform and educate you on medications that are given to you. They will also encourage you to be utilizing the incentive spirometer, a breathing tool used to help expand lung tissues and prevent post-op pneumonia. There is always a possibility that the new kidney may not make urine right away. This just means that the new kidney needs some time to adjust and will hopefully make urine soon. The transplant surgeons will monitor this and may require you to have dialysis temporarily. The team will update you on a plan if this occurs. Let's move on and discuss the next few days that you will be here recovering. On post-op day 1, you will have IV pain medication removed and be transitioned to oral pain medication. Your diet will be advanced to clear liquids. Diet is advanced slowly to prevent nausea and vomiting that can increase pain. IV fluids will be stopped in the morning of the first day as well. Once fluids are stopped, your diet is advanced so that you can eat and drink to stay hydrated. You will be weighed on a standing scale in the morning for the team to assess fluid balance discrepancies. This is usually done before 7 a.m. on the first morning so they can have them for morning rounds, and every day you will be weighed before noon for the rest of your stay. You will be given IV immunosuppressant medications over 4 to 6 hours with pre-medication, which will be explained to you by your nurse. It is given slowly to monitor vital signs and for any possible reaction to the medication. You do get pre-infusion medications to help decrease the risk of reaction per the medication policy. You are expected to sit in the chair for all meals and expected to ambulate 4 times. You can walk with a nurse or a family to help with lines and tubes. If needed, a physical therapy consult will be placed. We encourage that family who will be coming in for teaching to plan on being on the floor between 10 a.m. and 3 p.m. and to alert the nurse as to what days and times family can be here for teaching, so all specialists can meet and educate you and your family in preparation for discharge. Just to review, our visiting policy on the floor is as follows. Visiting hours are from 10 a.m. to 9 p.m., 1 to 2 visitors at a time for double rooms. Please designate one family member to receive updates from the team, and this person can update your friends and family as you wish on your progress. Transplant pharmacist will meet with you and your designated caregiver, whether that be a spouse, a family member, or a friend, who will be with you for 1 week after surgery to review medications. This also applies with meeting with the nutritionist and the attending nurse for all other post-op care education. All education that is reviewed can be found in the Butterfly book. We encourage patients to review this material prior to transplant. Medication cards with outlined medications tailored for your care will be created. Dosages will be written in pencil as doses can be adjusted. It is imperative that you always keep this with you and that you take the dosage of medication as indicated on this card. The pharmacist will review more in-depth education on medications, but you will be reviewing this with your nurse and be expected to become familiar with your medications prior to discharge. Case management will be working with your insurance company to organize medication approval, deliveries, and refills, as well as any discharge services that may be necessary, such as a visiting nurse or home physical therapist. Medication will be processed at Walgreens Transplant Specialty Pharmacy, which will provide a 1-month supply of medication. These meds will be delivered to the floor so that the patient can have home meds provided prior to discharge. At the follow-up transplant clinic appointment, the patient can inform staff if they have a different pharmacy that they prefer. By law, certain pain medications must be filled separately in person with the paper copy of the prescription. The attending nurse on Blake 6 will meet with you and your family members prior to discharge to review postoperative education. This will consist of knowing and verbalizing the signs and symptoms of rejection and infection, along with who and when to call the transplant team for emergencies and/or questions. Other information will be provided, and we encourage that the family is present for this vital information. By day 3, you will be ambulating 4 times a day, up in the chair for all meals, understanding medications, diet restrictions, and other post-op education. On day 3, the Foley catheter is removed by 4 a.m., and you will need to urinate within 6 to 8 hours after removal. This is to ensure that you can void without trouble after the catheter is removed. You should use either the urinal or hat provided for measurements. Now let's discuss the discharge process. At the time of discharge, when the team has determined it is safe for you to return to your home, medications have been delivered, and services, if any, have been set up at your home, your nurse must first check that there is a discharge order. Once that order is received for discharge, any leftover IVs will be removed. Please alert your nurse that you have a ride home and have confirmed what time they will be here for discharge. We encourage that family members will come to the floor for final review prior to leaving. Paperwork will be given to you, which will consist of medication information, appointments, discharge instructions such as diet and activity. This paperwork must be reviewed before you can go. You will sign off that you have received your discharge education and have had your questions answered at that time. For any further questions, we encourage you to call the transplant clinic, which can then be directed to a physician who is on call. If you have questions that arise before your first clinic appointment, please call Blake 6. Follow-up appointments will be at the transplant clinic, which is located at 165 Cambridge Street, above Whole Foods. You will not return to Blake 6 unless you are admitted again. For emergencies, we urge you to go directly to the emergency room. Thank you for your patience and questions. We want to welcome you to the transplant unit and look forward to working with you.